My name is Dr. Michael Zeidman. I'm an assistant professor of surgery at Mount Sinai. I'm a board certified general surgeon, and I did a breast surgical oncology fellowship at Mount Sinai. I now work at the Dubin Breast Center as well as Mount Sinai, Brooklyn. It is absolutely safe to get your mammogram now, and it has been for over a year. At the start of the pandemic in March of 2020, we actually did have to shut it down for a few months just to give us time to implement the appropriate safety protocols. Once those were in place, we reopened in, I believe, August of 2020. So it's been over a year. When patients come in to see us, we screen them for COVID with temperature checks and symptom checks. And we make sure that patients maintain adequate social distancing. We are only now starting to see the effects of the general hesitancy in the public of going to get your screening mammograms during COVID. It's unfortunately increasingly common for patients who are normally very regular about getting their screening mammograms to skip getting one last year. And now they're presenting to me with breast cancer that's likely at a later stage than would have been if it were discovered a year prior. Mammograms are the only imaging modality that's been proven to save lives. If we go back to the early 70s, before screening mammograms were widely implemented, the only way that a patient could discover that she had a breast cancer is if she felt it. Now that we have the capability to diagnose breast cancer before it becomes symptomatic, we're catching it much sooner. And so it's not surprising that survival rates have dramatically improved since then. While at the same time, we've been able to significantly cut back on the amount of treatment needed, which results in a better quality of life after breast cancer. So a very common question that I get from patients with a new diagnosis of breast cancer is, what's my stage? And I always explain that I can't tell you your stage until after the surgery. So the stage is made up of a few parts. Number one, the size of the tumor. Number two, whether or not the cancer has spread to the lymph nodes under the armpit. And number three, whether or not the cancer has spread to a distant part of the body. In regards to the size of the tumor, the preoperative imaging that we have does a fairly good job of estimating that size, but we won't know the precise size of the tumor until it's been removed. In fact, unfortunately, sometimes the imaging significantly can overestimate or underestimate the true size of the tumor. In regards to the lymph nodes, the only way to tell whether or not the cancer has spread to the lymph nodes is to actually sample a few of them during the operation. And we do that with a technique called a sentinel lymph node biopsy. Basically, we are able to, in the operating room, determine if cancer were to spread to the lymph nodes, what are the few lymph nodes that would be the first to receive that cancer? So we identify and remove those nodes. And if the pathologist tells us that there's no cancer in those nodes, we can safely assume that there's no cancer in the rest of your nodes. Stage 1 breast cancer means that the tumor is 2 centimeters or less, and there's no spread to the lymph nodes. And our goal is to catch breast cancer at this stage, because the 5-year breast cancer specific survival from stage 1 breast cancer approaches 100%. And the amount of treatment that a patient would need with this stage is much less than for later stages. It may result in smaller surgery. Patients at this stage are unlikely to need chemotherapy. And there are many other examples. Stage 2 and stage 3 breast cancer means that the tumor is larger and it has spread to the lymph nodes. If this is the case, patients need more surgery, are more likely to need chemotherapy, and all the while their 5-year breast cancer specific survival is now between 80 to 90%. And so this really highlights the importance of coming in to get your screening mammogram, because even though you may survive your breast cancer with a later stage, you're going to need a lot more treatment to do it. Stage 4 breast cancer is ultimately what we're trying to avoid here. This is if the cancer has spread to another part of the body other than the lymph nodes. And it's at this stage that I tell patients that I can no longer cure them of breast cancer. The 5-year survival rates drop to less than 30%. And while we can't cure it, we could certainly treat it. And depending on how aggressive the cancer is, we can keep the cancer at bay for many years. But still, this is what we want to avoid. Mount Sinai is consistently rated one of the best hospitals in the world, and for good reason. And the Dubin Breast Center at Mount Sinai is a true multidisciplinary cancer center with all specialists under one roof, concentrating on one problem, breast cancer. The treatment of breast cancer has become so increasingly complex as we've learned more about it. And so it's now more than ever important to have a team that works in a collaborative way to tailor a specific treatment program for you. We have state-of-the-art equipment. We have world-class specialists. We have fantastic nurses. The facility is beautiful. I feel like every day I come to work, I'm stepping into a spa. And that sense of calmness translates to patient care and to the patients themselves. And so while I generally recommend that patients go for a second opinion because of how complex breast cancer treatment is, I think it's imperative to come to a center where that's the primary focus. That's all we do all day. I just want to highlight again the importance of going for screening mammograms. I've noticed a general hesitancy among patients who skipped last year and now are paying the consequences. If there's one message I want to get across is, don't be that story. Come in, get your screening. It's absolutely safe right now. The sooner we catch this, the sooner we can deal with it, the less treatment you need, and the better your prognosis will be.